Welcome to the Coffee with Karen podcast, a weekly chat show discussing everything from holistic health to current affairs from a mental, physical, and spiritual perspective. Get your weekly cup of positivity with a sprinkling of woo-woo.
Welcome to a Coffee with Karen, a cup of positivity with just a sprinkling of woo-woo. So each week, my phenomenal guests will be sharing from either a mental, a physical, or a spiritual perspective, or in general, it tends to be a combination of all three. So my guest today is Dr. Tovah Goldfine. And well, I'm going to let her introduce herself. So if you could share with the listeners a little bit about who you are, what you do, and share a little bit of your story.
Well, I didn't know you before I found that you were interested in some guests, and then I went to explore you, and I see that we're in a career that's helping others, and indirectly it always helps ourselves because we're all growing. And it's great to partner with your clients and, patients' clients. So I now see what you're doing, and I think we're very similar. I went to chiropractic school after, dropping out of college and traveling and finding myself and realizing that this is the journey. It's not going to stop. This is the journey. I ended up coming back to Philadelphia and going to chiropractic school because I worked for a chiropractor, and I thought, wow, this is not just like doctoring. This is, what chiropractic's about? It's so phenomenal. It's like there's this innate intelligence. Your heart's ticking right now. Your stomach's digesting. You're not telling it what to do. It's happening. And what's running that? Well, my nervous system. Well, what's running that? I mean, this innate intelligence is being run by a universal intelligence. Let's call it Moses, Buddha, Jesus, Allah, and many other women's names. Let's call it these things. It's an intelligence that's making our body function. And we make sure that the bones are aligned and all the soft tissues are functioning. So your nervous system can fire the way it needs to fire. So I was fascinated by that. I grew up with a mother. My mother had multiple sclerosis. So I grew up in a household understanding something's not right here. Why is this happening? All those questions. I was one daughter. I had three brothers, very simple people in Philadelphia. And so the trajectory of my life was changed because of that. As I grew up, I was searching even deeper, even more. And so I got out of chiropractic school. I started practicing. And then throughout the practice, I began to notice, why do certain people get better and certain people don't? Why do certain people lose weight and exercise so easily? And why do certain people don't? It's not the food. It's the relationship with the food. It's the relationship with the pain. It's the relationship with the body. So I realize that I don't think a lot of people need tons of adjustments. I think the body's made to hold in alignment. We live with gravity. We have this structure that's affecting the function. People don't realize how important their posture is and how important the structure of even in expressing body language. How you were going to say something. I like to dialogue.
Yeah, no, I was going to say we see this so much, probably more so now. And I only say this from my background. I was in sports therapy for 27 years.
Wow.
So I worked with a lot of chiropractors because the two work synergistically, right?
Right.
But you just look at the teenagers of today, and I want to go up to them and say, stand up tall. I say to my daughter, put your shoulders down.
When I tell them to put their backpack up high over their backside, I say, I know it's not cool, but you're hurting your spine.
Totally. It's such a shame because you can see it around you, and having that knowledge, because we all want to avoid pain, and you want to see somebody avoid, them having pain further down the road, and you can just see it, and it's because we're all like that.
But Karen, we have an ego, and we need to look good and feel good, and this is a conflict between my monkey brain and, but it looks cool this way, and I don't want to look like a, because this is the dance between the ego and the heart, between the mind and the body. So that brought you, I think, to your work, and so this brought me to the work that I began to notice that people who weren't holding their alignment or coming back had more stress, and the stress was not physical, it was emotional. And I began to study more and more. The first book I ever read was the book called Anatomy of an Illness by Norman Cousins. It's a man, he was the editor of a Saturday Night Post in New York, and he went to a big conference with his wife in Russia, and he came back from Russia, and he felt on the plane, he didn't feel good. And he came back and he got diagnosed with an autoimmune disease called ankylosing spondylitis, where your joints begin to harden. We know too many people that have autoimmune disease. His wife was not sick. He went into the hospital. He had a really good doctor. Remember this point. He had a really good doctor who partnered with him. And he wasn't getting better, and he wouldn't understand what happened. Why was he healthy and now he was not well? So he looked inside. Most people are like, doctor, heal me. Not like, what's going on inside of me? How can I be responsible? So long story short, he decides with his doctor that this is a stressful environment in the hospital. I mean, it is what it is, but he felt stressed. He felt it was difficult. And he said, this is not a great place for me to heal. And I think I need to be relaxed to have my healing army come out. And the doctor, looking at him, he said, look, I'm going to go and rent a hospital room, and I'm going to hire a nurse. I want you to work with me, doc. Remember this relationship between the doc and the patient. He's in the hospital. He's injecting himself with vitamin C, which is very good for the joints and the muscles and the ligaments and the tendons. And one night he watches a funny movie, and the next day they check his SED rate, and it's way down or way up. I don't know which one. It was good. It was better. And he's saying, what was the connection, Karen, between the laughing and my chemical reaction? He says, click. He begins to Google. I don't know what they had back then. It was like 30 years ago. And he ends up watching Three Stooges movies all day, injecting vitamin C, staying in the hospital, staying in the hotel room where it was less stressful, and the arthritic disease was gone.
Wow. And
he began to understand how important it is when you go to a doctor and they say, there's nothing we can do. And that's honestly what the doctor says. It's not his fault. But then you say, that must be God, or that must be my father or my mother. And I'm going to listen to him, as opposed to, okay, doc, I get that this is your specialty. I'm going to go check with another doctor and I'll get back to you. And the doc will be like, great, fine, keep me in. Because that relationship is very important between the doctor and the patient, which leads me to the work I'm doing now, which is about mind, body, healing chronic pain and autoimmune disease.
Wow.
Because it's about
definitely a connection.
Karen, there's an intimate connection. Karen, intimately. When I exercise, I'm secreting endorphins, which are natural painkillers, and we know what they are. But do you know what that means? If they put, if they took my blood at the point, they see these endorphins and other chemicals running in my blood, and they're natural painkillers. Now, this is and we know about the placebo. This is very scientific. We know about the phantom leg, the guy, God forbid, his leg cut off, and he still feels pain. They have to train him that his leg is gone, because pain happens here.
Yeah.
So this is the science and art of the human body, which, again, thank God we have doctors, but they have a purpose for broken bones, for tumors. But you've seen, and I've seen your mother, the body heal over and over and over and over again. And now I'm seeing people heal from cancer to fibromyalgia to arthritis. And what is the common thread, Karen, of what people do when they self-heal? What is the common thread, do you think, that people do when they're like, I'm ready to take care? What do they do?
They have faith in themselves. So they have some kind of
Exactly.
belief.
Exactly. They take
There
responsibility,
you
and there's
go.
a biology of belief. That's what this Norman Cousins, his second book, was biology of belief. Because when I
What?
believe and have gratitude, Karen, it's changing my chemicals.
Wow.
This is science. I can send you or any listeners everything science, because I love woo-woo, but I'm not new age. I want people to see that it's science. And yet, you cannot scientifically prove a human body that's an art, changing every day. And then we're women. Don't you put me in a box. Don't you dare put me in a box.
Love that. Absolutely. And I just, yeah, I'm 100% with you there. There is so much more. The way I see it, the way I look at it, and I'm not dissing doctors, they know what they know. They know what they've studied and learned from textbooks who have decided this is the way it's going to go. But the issue I see with all of that, wherever you're at that moment, really the doctor is testing you for what's going on now.
And they're treating the symptom, which
Yes.
they're trained to do. Not you, but go ahead.
That's all they're going to do. And they're just looking at what's now. They're not looking at what's possible if, like you say, give them the correct nutrients that they need. So the high dose vitamin C for that person. Somebody else might need something else.
Yes.
Who knows?
Yes.
Who knows? Whatever. But getting that right, maybe detoxing some poisons and getting them in a, like you say, that good feeling place, whether it's to laugh or that feeling of gratitude, that is going to change everything. So then a week down the road, then you go to the doctors, you're going to get a different result.
Exactly. Every day your x-ray is different. Every day your blood test is different. It's an objective test. It's important, but we're finding now that MRIs are not enough, because people can have the same MRI or CAT scan and have different symptoms. So they're not telling us. And when people have a disc, this is science, you have a disc herniation or a disc protrusion or a disc pinch, a pinch nerve, this ends in a month, 2 months. This is not what's causing your pain 6 months later, 10 months later, 2 years later. It's the muscles. And what Dr. John Sarno, who's one of my mentors, Dr. John Sarno, who was a doctor in New York, a physical doctor. He was part of a big clinic in New York, and he was working with patients physically, rehab, and he kept saying, why are some getting better? And he began to step back and explore. He discovered an amazing method that, of course, all the doctors thought it was too much woo-woo for them. And I'll send you a movie called All the Rage, which is a documentary about Dr. John Sarno. And I'm going to send you the link. I have a free copy. Awesome. So Howard Stern and Larry David and amazing people are on it to say, and then there's real people like you and me who come on and say, I went to every doctor, I did the best I could, and then no one told me that if I repress my feelings and I stuff my emotions, that my brain will interpret a threat. At some point, it's working. Like I can just, but at some point the brain and the immune system communicate. Like, the stomach's like a small brain.
Yeah.
The immune system and the brain communicate and say, hey, I'm sensing with my neurons and my sensors and my wire together and fire together. I'm sensing something, and I'm going to have to bring out that inflammation and that muscle tightness, because I'm going to protect you, because there's a real threat. And all of this is your daughter calling and saying, Mom, I need a ride. And you're like, and she's like, I feel guilty. And so there goes the patterns of, I disappointed my mom. I didn't want to hurt her. And so we grow up and we behave in that way, not because it was a bad thing, because we
Right.
interpreted.
There you go. Perception. Again, everything down to perception. How you view that, or how you view, like you say, it could be something from years ago. So how you viewed something at that time
Yes,
and
yes,
responded in the only way you knew
yes,
how at that
yes,
time.
and you
Whereas
did right,
now you're
right,
older and you would deal with it differently. So we
right,
don't need to hold on to
right.
that
And we say, well, why
reaction.
can't I know it in my head? I can do it, but it's not about just knowledge. Knowledge is important, but we have to apply it and integrate it like you do with weights and you do with exercise and eating. And how do we apply and integrate good tools about eating? We have to be in the situation in front of a piece of cake and say, wow, now I have a decision to make. Okay, now I could eat it and feel guilty. I could eat it and feel good. I could just, because we have these sabotaging thoughts. It's the same thing with pain. Okay, now I have some pain. I can decide to take a medicine, or I can just be with it, breathe, be mindful, and I could practice the tool Dr. Tovah taught me, which is called Somatic Tracking, which means you just watch the darn thing and the pain goes away. Or you just accept that you're uncomfortable and that it's just it's not in your head. I don't like that statement, but that your fear, and this is science, your fear of the pain is much greater than.
Right. Yeah, that makes a lot of sense. So again, it's interesting that you bring up, the things that seem so simple. Everybody breathes. So what's breathing? How is breathing going to help? Yeah, but we all breathe wrong.
And no
So
one taught us, no one taught us. And when we're anxious, it affects our breathing. And that's one of the first things we notice. What's going on with your breathing? Where's
there
it
you
getting
go.
stuck? Because when we notice
Stress.
our anxiety, Karen, we become aware of, I was anxious starting the show. I decided to not go to the computer and sit on my chair and breathe because I know I'm anxious. I go live every week and I still get anxious because I'm friggin' human being. I'm human. Come on. Like the perfectionist thing. And this is the personality. Look, you probably know in your ladies and your guys who you train, there's a personality. And God bless us sensitive, strong people who are doing this work like you and me, because we're here because we're healing ourselves. I know I'm healing me.
Totally. I think every coach I've ever
Yes.
had, they've
Yes.
overcome something and then
Yes.
wanted
Yes.
to.
Yes. And we need to, I lost my train of thought because that's human. So go ahead.
Yep,
So
we're
help me.
human.
Yeah.
And that is
Yeah.
exactly it. Just
Yeah.
we're still going to get nervous over things,
Yeah.
but it's interesting you say when you know you have the tools, like you say, we weren't taught. We were
Yeah.
never taught that when you get
Yes.
anxious,
Yeah.
sit and focus on your breathing, because everybody would, well, of course we breathe every day. Well, no, not
Right.
in the way that we need to
Yeah.
encourage healing. Now, I mean, I know about breathing. Trust me, I know about breathing. I have this little, I still struggle
I hear you.
sometimes
Yeah.
with my
Yeah.
with my breathing. So I totally understand how important
Yeah.
that is, and I can be very much up
Up
here.
here. But when that happens, let's let's test you. I have my little postnasal drip because it's moldy or it's when I get nervous, I get a little bit more mucusy. That's
Hmm.
my go-to.
Hmm.
Okay, so I just say excuse me. Now let's test you. Okay, when you get anxious, you're with a client and you get uncomfortable because they're how do you settle yourself? How do you not be critical? How do you not judge yourself? How do you be like, it's okay, girl, talk, let's talk, because let's put you on the chair and say,
Yeah,
how do you deal with stress?
how I do. Oh, definitely meditation. I have a 10-minute. Um, I'm not very good at doing it on myself yet,
Okay,
right? So
human,
yeah,
human.
I'm not perfect.
Hello.
So I like to, and I like to have it talking me through. And now I have actually my own self, my own recorded voice talking
Good,
me through it.
good.
So I have something that I can, so that's not going to totally, send me to sleep, but
Right.
it's just a 10-minute, it's almost like a 10-minute
Everybody
reset.
should have this, and I'm interrupting you like this is what we do when we
Go ahead.
because you come to Israel, you learn a couple of Israeli habits, and we're like, I gotta get it out, I gotta say it. Listen, I want to tell you something. Mindfulness is the key. Your breath is the key. When people are with their breath, they're never in pain. They're the healthiest, the strongest, the most stable. But let me ask you, if you're nervous talking to someone, or you sense some stress with your husband, with your children, with your clients, with your, how do you, in that moment, that's when we don't learn it on a mat or in meditation. We learn it in the field. So you're in the field. Share with me how maybe you messed up. Did you accept yourself messing up? Did you say it's okay to mess up? Or did you judge the hell out of yourself?
Yeah, well, I would say, and I think my children would agree, I am a little bit of a reactor. I'm very, I can react to the moment. So I can be, and then I can be,
Impulsive. You're excited.
I can be very up and down. However, I don't hold on to it. And for me, and I'm not saying my way is the right way in any way, because I can fly off the handle as quickly, but I don't stay there long, and I can come back down. And then I don't hold onto it.
Good.
And I have always thought, then when I look at people that really hold on to, or if I've had relationships where people hold on to things for way too long and overthink it, and I think, yeah, but that's more damaging because you're staying in that stressful.
Well, you're causing your brain to hold the fight and flight and create that.
I'm like,
right. So this is good. This is a way. Look, anxiety is good. Anger is okay. We're not talking about negative or positive emotions. Thank God, when I put my hand in the fire, my brain says, "Take the goddamn thing out."
And scream.
I don't like to curse, but it's.
I can scream. I can be loud.
Okay. So anxiety is there to tell us when you get excited, Karen. That's you getting excited about who you are, what your work is, helping many people. So you're aware that if you stayed in that excitement, you would probably have some pain that you need to calm yourself down, breathe, and get grounded. So I feel like you're watching yourself and you know yourself. And what the first tip is, I'm going to leave with the audience, and anyone can email me and text me and find me, and I'll send them anything. This is free. This is nothing. This is what people do for each other. Sure, people hire me. That's what we do for our career, but there's so much people can do on their own. And yeah, sometimes people need help. I need a coach. You need a coach. We're human again. But the first thing that you do automatically is you react and then you go into response. So you immediately do that, and your blood pressure, your whole body, whatever is flowing. Okay, and you're not getting itchies, you're not getting runny nose, you're not getting short of breathing. Your body's immediately, and it's got a nice habit to do that. So if someone else is reacting all the time and not responding, their brain will be on fight or flight. But if they learn to respond to something, it's a whole different chemical reaction. Now, people can be calm. Like me and you, we're extroverted, we're out there, excited people. Okay. Now, someone else might be very calm and quiet, and inside of their unconscious, their subconscious, they're freaking out. They're like, oh my God. And I don't think in the study, in the work that we do, we bring the unconscious conscious. So I can know that I'm calm here on the show, but like inside, I might be really nervous. So I'm talking fast, and I feel myself slowing down. Hey, I even put this up when I go on the camera.
Talk slower, think smarter.
Okay.
Love it.
I'm 64. I'm not going to test my ego. I'm human. I forget. I mess up. I fall and I get up, and I fall and get up. So the first tip is to practice till it becomes a habit, like Karen does, to respond and watch yourself responding to a situation or saying, I'll think about that, or I'll get back to you. There's things, as opposed to this impulsiveness that we have to want to help, to want to serve. And most people, I have patients who take care of their dog better than they take care of their own selves. And they know it. They know it. They know that self-care and self-love and self-acceptance is not easy. And it's so much easier taking care of another.
It's so interesting you bring that up, because I think we, even just on the last call, she was talking a lot about self-care in a totally different context. But
yeah,
where do you think this all comes from? Because like you say, people are looking after their dogs better than they're looking after themselves. Or I'll go one further and say people look after their cars, you know.
Right. Oh my goodness. Good one.
Way better than themselves. Where do you think this comes from? Because there must be a I don't know, almost a guilt.
A good question.
How
Absolutely.
dare we look after ourselves?
Absolutely.
Where do you think it comes from?
It comes from deep-seated patterns that start in childhood. And look, I'm a grandmother, and I've been married, so I've been divorced, so I understand the drama and trauma of relationships. And again, like I said at the beginning, it's about a relationship with yourself, with your pain, with the food, and never about the food or never about the symptom. It's about the relationship. And this is where the healing can happen. So in childhood, we do learn habits, and it could be something very simple. There's a YouTube I'll send you, Karen. It'll be interesting. And it shows a mother. A doctor was doing some research, and he had a mother and a baby playing. And he said to the mother, now look away from the baby and then have a straight face. They call it a still face experiment. So the mother looks away and comes back. And the baby, you watch the baby get hysterical. And you think something that simple. So we're not here to blame anybody. We're parents. We're learning this on the job. And all we can do is raise children to just be more aware and learn. Okay. So it can come from trauma. It can come from an old trauma. It can come from, I believe in past lives. I believe in stuff like that. And I'm not, and woo you. This has been researched. Okay. So it can come from a trauma. It can come from everything's fine in my life. Everything's good in my life. And then I'm in an accident. And I mean, listen to this story. I have someone who she has horrible ringing in her ears. Okay. And she got it after she had a tooth pulled. No, you think, okay, it can happen. Sinuses, all these facial muscles, all the of course you could, but it goes away. The ringing goes away. Now, her father died of a heart attack after an infection from his tooth. So she was fine until she had her tooth pulled. Here's an example of that we live our life, we have our memories, we manage, we juggle, we dance through life, we do the salsa, we do the waltz. Something happens and there's a connection, there's an integration between the little girl and the big girl. I mean, and this lives in our muscles. Our memories are there. The subconscious is the body. So the body has these feelings and thoughts and memories. And there's even this work called the heart math, where in the heart, there's these memory cells. I don't even go there. I mean, it'd be fascinating to go there. So the poor woman knows it. She knows it in her head that trauma, and the doctor even did whatever. The doctor, this is about her and her mother, whatever. It's a trauma. Many of us are resilient. We get over the traumas. We heal. We fall again. We heal. Karen, she's a delightful, lovely woman. She'll probably watch this when I send it out. She's stuck. And it's about getting into your heart. And you're like, oh, doc, that's woo-woo. And I'm like, Karen, this is about self-acceptance, self-love. This is about, I have been criticizing myself and judging myself because I've had 5 babies, and this woman had children, and she's retired. Of course she's retired and everything's fine. And they moved into, and this comes up and you think bad timing, as opposed to, what is my pain telling me?
Right.
What's the message? What's the message? It's a second tip. Ask your pain, ask your anxiety. What would you say? What are you telling me? How can I learn about myself? You're not against me. I'm not a victim. If I'm in pain, or if I gained a few pounds this week, what is going on? I'm not going to blame someone out here. I'm going to be responsible. I'm going to respond to my upsetness, my sadness about, and my guilt about that I gained a few pounds, or that I can't get rid of the pain this week. And I'm going to wonder what's going on. And if I don't know what's going on, and I can't tell Karen that, well, I guess I just gained the 2. Can I accept myself not knowing? Can I accept myself being spaced out? Can I accept myself making a mistake? This is a key, because we're so hard on ourselves, which is answering your question. We're so hard on ourselves, and it's much easier. We get enormous amount of attention and love when somebody's on the other side. We know that. But when I'm alone with myself, so I love my dog. He gives me attention. I can help people. I help the nurse. I take care of this person. I take care of that person. I get this gratification. Well, I need to learn to be able to self-care and take care of myself on the deepest level. Now, outside, I look good, I feel, but inside, I'm abusive. There's the disconnect. So, and this is not to blame anyone, it's to say, people, you are the doctor, you are the psychologist. The solution was in you before the problem. Go to your doctor and say, partner with me. The relationship between the doctor and the patient, between the coach and the client, is very important. It's a safe place. You have to learn to trust. We grow up, sometimes we don't have trust. We're pissed off at life. We just went through 2 years of COVID. It's not over yet. I mean, come on. The world is changing, and this is important. Tip number 3, we're not affected by this outside world. Things happen politically, environmentally. I'm still responsible, Karen, for my response to the corona. I'm responsible for my response to the bad air. I'm responsible for how I handle my relationship with pollution, with pain, with food.
There you go.
So this is it. And I studied the doctor who invented cognitive behavior modification was named Dr. Aaron Beck, and he was from Pennsylvania, Philadelphia, where I'm from, and he studied at the University of Pennsylvania, and he invented this cognitive behavior therapy, which is something like what I do. It's similar, and his daughter wrote a book called The Beck Solution, and it's a wonderful book about knowing yourself. And it's not about the food. It's all about like sabotaging thoughts and knowing who you are and why you're not losing weight. And you think it's the cake, it's your mother, so it taught me about the relationship. And then I went into the pain healing, and it felt like the similar relationship, because we use the food to distract us from our feelings, and we use the pain and anxiety to distract us from our feelings. And all we have to do is say, hello, you're feeling sad. Hello, you're feeling anger. Yeah, you have fear. There's a woman in Britain who wrote a book called Feel the Fear and Do It Anyway.
Do it anyway. and that is, because it is, isn't it? It's the fear that is, you said that earlier, the fear is bigger than the actual.
Fear is our brain making up a monster under the bed.
Story. Yeah.
And you who can put your hair like that must be very comfortable with the monster under the bed, because all the honor to you. You are courageous and brave. You are courageous and brave, and it's gorgeous and my favorite colors.
Oh, thank you.
Right, but this takes, like, you're saying, like, I am woman, hear me roar. Like, I'm okay with this. It's kind of funny. Yeah, it gets me attention, but I like it.
Absolutely. Do you know, it's so funny. I've had this for a very long time, and about 20. Oh, it is about 20 years ago. No, from about 20 years ago, I've sort of always had braids. I've had braids all my life, but went to the multicolours, and then we moved to the Algarve back in 2004. My youngest was born there, and went in a shop, and a Portuguese guy said to me, "Aren't you a bit old for that?" And I went, "Oh." And I actually took them out. I can't believe I took them out. And
When
then I
did you took
came
them
back.
out?
I
You
took
hit
them
him?
out. I
You hit him?
took on that. I was like,
Oh.
am I? Okay, maybe I should take them out. And then and then since then I've been back 10 years, and now
Oh,
they're
you
back
mean
on.
on the show? On the show?
No, it was.
Oh.
I was just out and about, and some Portuguese guy
Oh.
said to me, "Aren't you a bit old for that?" And I actually did. I actually took them out. Now, I mean, I'm now, I don't know, at 10, 15 years older than that, and I don't care. They're back in.
Oh, you took the hair out. You took the
Yeah, I took the
extensions.
braids out. Took all the braids out. Oh, okay. Am I too old for it?
Oh.
Now I don't care. No, I'm not listening.
So
to any of that.
let's analyze that. So you felt insulted.
Yes.
You felt insulted, and you thought, wow, maybe he's right, and I'm questioning myself. I'm doubting myself, which is perfectly normal.
Yeah.
And I think, well, maybe I'll take it and I'll go and take him out. And then,
Yeah.
and then were you thinking? And then years later, you just thought, hell, like, I don't know. Tell me what the process was, because this is interesting.
It was somebody that said to me, "Oh, you're the girl that used to have the pink braids." And I said, "Oh, yeah." And I thought, "No, I miss them."
Yeah. Okay.
And I thought, "Yeah, I don't care. I'm 15 years older now." But for that Portuguese guy to tell me that I'm too old, I'm going to be 50 next year. I don't care.
Right.
I'm still going to have them.
Right. Now, if there was a client of mine who's maybe, look, my father would say to me, may he rest in peace, whenever I was sensitive, he'd say, are you having your period? And so what did I grow up thinking? Something is wrong with being a woman. And I would go to a therapist and say, could you make me not sensitive? Could you help me? I need an alligator skin, so I can. And he was like, I'm sorry, you need to channel that. And I was like, no, I need to lose it. I need to get rid of this. It's a bad characteristic. And I'm thinking, this is how I grew up, hiding behind myself, criticizing myself, judging myself, already like, I'm sensitive. Now the sensitive is the new strong, and that people have to write a book about it because we're so darn insecure about it. It is a human quality to be sensitive. It's an empathetic, and yes, it has to be channeled. We all have fear, but fear also propels us forward. Tell me about the fear you had coming on a live show like this and doing this and putting yourself out there like that.
Do you know, it's interesting, isn't it? Because people would say, they would look at me and they'd think I'm confident. And yeah, I mean, look, I'm going out with pink braids, it's not an unconfident person. And all my life I would teach, I'd teach fitness, I'd get in front of however many people. But I would not, photos, I've got a real thing about photos. I will hide. We have this sort of ongoing little dance, I would say, with a photographer at an event that I tend to go to quite regularly. And it's a bit of an ongoing joke because I'm always hiding from the camera. I just won't be in any of the photos. But yet, I will come on, do lives. Yet, I will get up and speak from stage, although I'm not going to lie, the first time I did that, I've never felt so much fear in all my
I hope so.
life.
I hope that taught, yes.
But it's mad, isn't it? So I will run away from a camera. I don't like photos. I don't like selfies. Won't take photos. But yet, and again, I'm not going to lie. For doing videos, I would, I just almost blah, 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 I couldn't get the words out.
Yeah.
But isn't it just like anything that we learn in life? In the beginning, it's very nerve-wracking, and as long as you just keep going through it, and now I could turn it on whenever. I wouldn't have the fear.
But you had to practice, Karen. There's a book called The Talent Code. It's written by a scientist about these great actors and these great musicians and these great runners. They had to fail. They had to fall. They had to knock their nose against the wall many times. Like Einstein said, you keep knocking against the wall and getting the same result. Go to a different wall. But we have to make a mistake. I had to get married once and maybe another time. But anyway, we had to make a mistake. This is how we learn. And
Totally.
look, some parts of society do hold the bar up, and that will attract different people. Probably not me and you. Okay. But deep inside of us, we have a perfectionist piece of us. It's human. Deep inside, we have a child that wants to progress and maybe was stomped on. Or my show this week was called, What If You Were Never Shushed? What if, because parents shush you because they love you, or they don't want you to cry because it's their anxiety. It's their anxiety. So you grew up and you're hiding behind every time someone talks at you, and you're feeling like something's wrong with you. It can be that simple, and it can become something that causes your immune system and your brain to just overprotect, oversecrete. So all this work is, and I think it's very similar to your work, is it's not as simple as learning new habits, but it really is. Okay, Karen, you get up in the morning, you brush your teeth. Do you ever question that behavior? It's automatic. It's automatic. Now, I want to learn a behavior in my 60s. It's possible in your 80s and your 90s, because it is about the human mind. Oh, by the way, the mind is not something that's controlling you. You are the navigator. You are the conductor. It's between you and God, because he made you, and he's got a piece of you. And again, it could be Moses, it could be Buddha, it could be Jesus, it could be Allah. I'm not going there. I'm not talking about Corona, religion, or politics.
No.
Anyway, I'm talking about health. And, it's like, it's so funny because this wonderful doctor named Gabriel Maté, he's an internist, an amazing doctor. He's doing a big thing on the Facebook about trauma, the wisdom of trauma. He wrote a book called When the Body Says No. It's because you're always saying yes, 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 yes. And you're not being yourself. And he talked about authenticity. But I'm getting to a point here before I want to get back to authenticity, which I think you're very authentic, really, in every possible way. And I believe that, but we had to learn it. We had to screw up and mess up and fall. But Gabriel Maté thinks that all the presidents and all the prime ministers and all the people in the government are traumatized people. And they're playing out their little roles. And because who would want to be a megalomaniac? I mean, like, you'd have to be a megalomaniac. And I'm still waiting for an honest president or prime minister. I think the women have been amazing. Women across the world have been outstanding.
We need more. We need more.
And I'm not a sexist. I'm heterosexual, and I think a man is good, and I think a woman is good for what they do. I'm not about that. I'm kind of old-fashioned. You want to hold the door, fine, but I'm going to pay half the bill. Are you okay with that? But the point I'm making, see, when I get anxious,
I love it.
The point I'm making is that if we understand ourselves, we'll know that trauma is part of life. It's part of how we grow, honey. It's part of how we bring children in this world is not an easy place.
No. And everyone's got a story, haven't they? Everyone.
And it's similar. The movie Finding Joe, about Joe Campbell. It's about the human condition. Every movie is the same beginning, middle, and end, about the human condition. And if we can accept ourselves, stop comparing.
Yeah, stop judging.
Stop judging, and notice that if I am judging something in me, I must be judging others. And that's human. We have this thing in Judaism, it's called like no gossiping. It's a beautiful concept. It's a beautiful, it's a beautiful concept because you're hurting yourself. You're hurting the person. And it's true, you're hurting yourself. But it's something we do. And we could even be like trying to help someone. But it's a natural thing we do when we're anxious, or when we want to talk to someone, or when we, you know what I say when I go on a date? First thing I say is, I am very secure that I'm insecure.
You're very secure.
Secure that I'm insecure.
That you're insecure.
I am sure that I'm insecure.
You are insecure.
And I think that's me carrying my baggage high.
There you go. We all have our everybody's got your insecurities. And like you say, it's almost like, why are we trying so hard to be perfect? We're
not who we are. Not who we are.
Be.
Right.
We've all got our little weird quirks.
Right. Right.
Some have more than others. I've got a few.
Right. I mean, the courage for you, you know, I always kind of want to sound professional, like, you know, but the courage for you to do the woo-woo thing is like, whoa. I mean, coffee with Karen and a little woo-woo. I mean, brilliant.
Because we need it, don't we? Because, you said right at the beginning, so many people, they will shy away from it. That's why it's just, you know, come on, let's just sprinkle it a little bit in, get people used to it, because it is I think, like you said, you know, we've got proof, and this is the trouble, isn't it? Everybody wants to see proof, scientific data on the fact that the mind and the body, we know now. I think everybody listening can totally get.
They're intimately connected. They're intimately
connected. There's an absolute. We know that. But what everybody else needs to understand, there is a third part. And the third part is the biggest part. But let's just introduce it a little bit. So you cover, I quite like the idea of becoming a chiropractor. I just didn't fancy the amount of years it was going to take me on top of everything else. But, you know, having those little micro corrections, I would notice a huge feeling, because I totally agree with you when you said about everything is coming from spirit. However, we are spirit living in a physical body, so we also need to look after this physical vehicle that we find ourselves in, and there will be things that we do. And myself included, you know, I can be sat in my posture, you know, I can notice my posture terrible because I've had my head down looking at my phone for ages.
Hold the phone up here.
Yeah.
Hold the phone up here. It's good for your biceps.
Lie back.
Or lie back.
We need it. We need it. And everything we do, and women, I'm not going to say women, women probably more so than men, because of what we've done, maybe used to carrying a baby on one hip. We will probably tend to maybe stand a little bit out of sync, and that can, anything that we do habitually, like you say, over and over, can move things out. So having that correction, so what you're doing with the physical aspect of correcting the spine, I think massive, and so many people I can look around, I think you could do with seeing a chiropractor. You would probably benefit from seeing a chiropractor. But then what you're doing then on top of that, so do you do it with your sessions, or do you do it as a separate?
Good question. So my passion, really, I love doing chiropractic. I'm a very gentle chiropractor. My brother's a chiropractor. He's more high force. People like that. I don't do that. I'm a more gentle. I do a lot of massage. I do a lot of stretching. I do a gentle manipulation. And by the way, on the record, that popping sound is in your joint. It's not a crack. It is a bubble of fluids inside the joint that's hydrated, thank God. Otherwise, it becomes arthritic. It's a hydrated joint. And there is movement. And many times you're moving and you get the pop. Now, it's not a crack. We do not crack. We gently manipulate. So, but if people have chronic pain, I can help them with the chiropractic adjustment, but I begin to talk to them about the mind and body and spiritual aspect of, because chronic pain and autoimmune disease are not normal.
No.
I am meeting more and more people. I have a show every week. It's called TMS Roundtable Global, and I have a co-host and a partner in Australia. Never met her, but we're best friends. Talk about the internet. If we're dependent on one thing, sweetheart, it's the internet. So I praise down to the internet gods. And so we go on each week and we interview with doctors and therapists and movie producers and people that have self-healed. And this is not spontaneous remission. These are people that healed from MS, and I'll send them anyone to you to come and talk about their journey. It's unbelievable. It is a journey. It is not a cure. God cures, the body cures over and over again. When we get sick, it's not normal. You get a bullet, God forbid, you get cancer, God forbid, but the body can heal. This is not a permanent, okay? You take the radiation, you take the chemo, fine, but you understand. I have a woman who says you must love your cancer. My mother stood up. We went to see a doctor named Dr. Bernie Siegel, who wrote Love, Medicine, and Miracles. He's an internist in Connecticut. He was speaking at the U of Pennsylvania. My mom was in a wheelchair, and I took her to see him. And she stood up and she said, "Why do I have MS?" And he said, "Well, you caused it." And I thought, well, Karen and I can understand that, but my mom's not going to understand that. She's not educated. Now, I don't know what she did with it, but she did do incredibly better and had a long remission eating macrobiotics. Okay,
Wow.
the myelin sheath, which is the wire around the wires that get exposed, the myelin sheath gets degenerated, is made from B vitamins and other things. So I wonder, of course, the nutrition. So what I'm saying is that I lost my train of thought again. I'm having a human experience.
When you took your mom.
Yes. So it's basically when we take responsibility, I think this is what I'm seeing in my show, right? The thread across the people that, so this woman has a tumor around her heart. Nobody's diagnosed. They think she's psychosomatic. Finally, they do an X-ray, they do an MRI, they see it. They go in there to do a biopsy, and they understand that it was so closing up on her heart that her body went and made a bypass. And I've heard this story many times, where the body will make a bypass, like another road to get the blood to the brain.
Wow.
I have two stories. I have another amazing coach who does a show in Arizona. And this other woman who I've spoken to, I just gravitate towards these people because it's like mind-boggling. The body made a bypass vein because the main artery was not taking blood to the brain, and the blood was getting to her brain. She came out of the biopsy and she said, "My body can heal." She took a few chemos because her mother would have killed her if she didn't. But she decided to what's going to happen with my side effects. She determined about her hair, about her throwing up. She decided she was the placebo. The placebo. And then she learned a lot about herself. And she said she is connected to her little girl. And she never makes a decision, nothing, without asking her little girl. Because she understood that was the soul. That was the voice. That's the subconscious. That's the spirit in us. That's the part of us that we have to friend. That's the part of us that we're estranged with. So when you talk about the soul and the woo-woo, this is the ultimate relationship with ourselves. And because we've gotten so physical and so, look, we all are human. We've gotten very physical, very into things, very into stuff, very into mechanics, very into stuff. Okay. I had a couple iPhones stolen. I thought, is God giving me a message not to have an iPhone? I said, no, go get another iPhone. Like, we're all human. We're all human. So the point is, we're aware that I'm attached to the physical stuff, but I'm really, like you said, massive without it. And I'm way more than these physical things that break and cause pain and cause me hurt. And I lose people, I lose love. But if I have my soul and I'm connected to my inner voice and my subconsciousness, I can control my thoughts. This is what people do with their thoughts. This is how people heal. This is science. Now they want to study it. Go ahead and study it. It's okay. Knock yourself out. I'll find a research paper on anything you want to study because that's the nature of science. And
Yeah, sure.
I'm here, and I'm not here to argue. Doctors are amazing. Scientists are amazing. I think that they're artists, doctors and artists. But I think it's a beautiful thing as we accept ourselves, as we accept um, our life experience, as we accept our past, as we don't get fearful about the future, we're in a place of calm. And then woo-woo is like a place that I'm not in pain when I'm in woo-woo. I'm not judging myself. I'm really accepting that I'm a spirit. And that can be scary, Karen. And you obviously came to terms with your spirit somehow. And now you're teaching others about it. And I'm just thrilled to meet you.
Oh, bless you. Thank you so much. So for people to find, so people who are just listening and they can't see the links, so depending on where you are right now, how would people find you? What is your
well,
website?
Dr. Tovah Goldfine, Dr. Tovah Goldfine all over. I'm also TMS Roundtable. And when you TMS, you'll learn what it is. It's the name of this sort of mind-body pain that people get. It's coming from a psychological cause, so it was named something. I'll send you the movie. It'll blow your mind.
Lovely.
So TMS Roundtable, Dr. Tovah Goldfine, and nowadays we can find anybody if we want to. But I give everybody a complimentary consultation if they want to talk about woo-woo. We're all on the journey together, and I think sometimes people want to know that their doctor, their coach, is with them. It's about that safe place. And I think and it's the humor. The humor, as we talked about with Norman Cousin, is so important. Because how serious can we get sometimes? Like morbid.
Oh, for the last 2 years, hello. Do you know I don't even have a TV in my house, so
Neither do I.
For nearly a year, last Christmas, my daughter and her son, my daughter and her boyfriend came over for Christmas, and it broke then, and we weren't bothered. We had Netflix if we needed it. And I have got a little projector. It cost about £60, about $90 US probably.
Yeah.
So, I can watch things. It's not like I've got nothing, but I've got no terrestrial doom, gloom.
Or you've learned not to react to it and hurt yourself.
Well, I just don't want to. I'd rather not listen to it. I don't want to listen to it. So even the TV in the bedroom has actually, now the aerial's broken, and I have no inclination to fix any of them. So I've done with it without a year, and I love it. I do get a little bit confused because I don't really know what's going on unless I see. You can't avoid it. You've got Facebook. I can't avoid it if it's anything major. But I'm still a little bit like, I don't know. What are we allowed to do? What are we not allowed to do? I'm going about my business as normal. But it's not good for you, all that. And yet, going back to the fact there's not enough humor. Everybody's been taking everything so seriously.
And it's because of the media. It's the media. And the media doing their job. The media are doing their job.
We need more comedy. There's not enough comedy out there. There's not enough comedians out there. There's not enough to make us laugh. Everything's got so serious. And, all these things like, I can't even think who wrote the book, don't sweat the small stuff. And by the way, it's all small stuff. Like, it is.
Yeah.
It's so true. What you're doing is, I love it. I think that is absolutely phenomenal. And for anybody who's out there that is listening, who does think that they have a life sentence, as in some kind of autoimmune disease, it's just so lovely to hear from somebody like you that there is hope.
Always the biology of hope. There's a biology of hope.
There you go. It's that belief system you've been told.
And even if you don't believe it, try it, because you can learn to let go. Because what is the ultimate form of control? Letting go. So we're all learning this together. And so on my show, I have about 100 shows of people healing. And, it's just fascinating. And there's a lot of things going on about this. We're a slice of the world, you and I and some of the people I work with, that people are opening up to and seeing that there's an alternative.
There is an alternative. So there is hope. So please, anybody listening that, because again, a belief is just a thought you keep thinking. So it can be changed.
Brilliant. And don't believe your thought. But thoughts are not always to be believed. The Byron Katie work is brilliant. Don't believe your thought. Make sure, accept responsibility for your thought.
So please get in touch with Dr. Tovah Goldfine. I think what she's doing is absolutely amazing. And you really are doing a service to the world, because yes, there's too many people out there that have been given that label of an autoimmune disease.
Yes.
So I really appreciate your time. I'm so glad we met virtually. So thank you for your time.
Thank you.
To the listeners, I will see, or you will hear me next week on A Coffee with Karen. Bye for now.
Thank you, dears. Bye.
Welcome to the Coffee with Karen podcast, a weekly chat show discussing everything from holistic health to current affairs from a mental, physical, and spiritual perspective. Get your weekly cup of positivity with a sprinkling of woo-woo.